Well, howdy YouTube family. It is Bolt CRNA coming to you with another week's topic. This week I want to talk about something that I got an Instagram message from one of you guys about that I thought this is something we need to talk a little more about here in depth in a video. She was saying that she's a third year nurse anesthesia resident and she is feeling like she's not very good at her skills. She feels like she has some good weeks and some bad weeks, and it's making her nervous that she may be approaching graduation this year and not feel very strong clinically or like she knows what to do all the time. So what should she do? Should she beat herself up over this topic? You know, what ways can she improve? So I want to talk a little bit about this today. Now, first, let's start off with the fact that life is a journey, education is a journey. You are not going to get everywhere you want to be in 3 years of CRNA school. You're not going to finish CRNA school and decide, you know what, I'm genius. I know everything there is to know. I clinically am the best at everything. I'm the best at all the skills. I never make mistakes. That's just not realistic. It's not going to happen. That's not going to happen for you 5 years into practice or 20 years into practice. You will never be amazing or perfect. And there's so much to know about anesthesiology and so much to know about medicine and nursing and healthcare. It's a massive, massive field. And the more you start to feel like you know a lot, the more you'll break into a new area. Like you'll start doing cases for pediatric oncology type situations. You'll realize there's a whole spectrum of stuff that you've never seen before or never really experienced this type of medical management that they're doing and the types of cases that this surgeon is operating in, and you realize there's new things to learn for you. You know, those are things that just happen as you go along in your career. So as a nurse anesthesia resident, keep that in mind, that your job is not to be amazing and perfect and the top at everything, even by the time you graduate. You will be safe, you will be knowledgeable, and you will be a good provider to practice anesthesia independently when you graduate. And that is the baseline for you graduating and passing boards. And there are lots and lots and lots of checks and balances and barriers put in your way all along the 3 years of the program to ensure that you are hitting these benchmarks. Some of you hit them a little bit stronger or faster than others, and maybe you hit the benchmark for intubation really early on and you're like pretty skilled and smooth at it, but you kind of suck at arterial lines or central lines, and those you really struggle on, and it took you longer to hit that benchmark, whereas your classmate kind of was sucky at intubations, but was really good at art lines and central lines pretty quick, and it took them 5 of them, and they got it down, and they were hitting it good. And then you may find out that both of you 2 years from now still have bad days where you're not doing that great at either. Don't be hard on yourself is the number one thing. I tell you, like, just take a step back, realize you are probably being way too hard on yourself. The typical type A personality of people who get into CRNA school are perfectionists. They usually hold themselves to an extremely high standard. They really push themselves, very ambitious, and they have a tendency to berate themselves and tear themselves down internally when no one else around them is expecting this much out of them, or no one's expecting them to be this superhuman, but they believe they need to be, and until they are, they should just tear themselves down internally. And that's not helpful for you. It's not helpful for your patients, and it's not really going to serve you in any kind of way to improve yourself. So what should you do? So once you've calmed down, got out of your emergency fight or flight mode, and got your heart rate down, and realize you're not perfect, and that's okay, and you'll never be perfect, and that you will always have bad days, then you can kind of clear your head and start thinking, well, so what is some things I can do? Maybe, so today I was not that smooth at intubating this patient, and I had to grab the glide scope, and you know, the patient desatted for a second, and I fumbled around and my hands were shaky, and then I needed to start a second IV, and I blew the IV twice, and you know, then I tried to do the art line, and the art line was really hard to thread, and my preceptor had to come over and help me do the art line too, and it was just a whole lot. And then the surgeon got upset because I kept, you know, messing with the bed controls the wrong direction they wanted, and those kind of things happen. And truly, you will have days like that where just snowball effect of just things are just not happening smooth for you, and you're just not feeling it that day, and that is not unique to being a nurse anesthesia resident. How you get yourself out of your mind, realize you're great, there's nothing that you need to be beating yourself up over, you are not perfect and you will never be. Then you start saying, well, what are some ways I can improve? Ask your preceptor who's working with you. Say, hey, I did feel like I was stumbling a lot today, and I know that I'm not perfect and there's always room for improvement, but did you see anything specifically in what I was doing that you would recommend me change or work on? And they're usually going to tell you. When I work with nurse anesthesia residents, I tell them, if they're struggling, one, I always make sure not to beat them up. And I always make sure that they understand all the positives of the things that they did. And I remind them that there are always bad days and to not beat yourself up. But then I will give them the constructive feedback of like, I noticed the way that you're intubating. You like to use the Mac blade, and you're lifting up like this, and you're cranking backwards, and you're never going to get a clear view like that. You need to pull forward. Think about pulling towards the corner of the room opposite of you this way, and lift up away from the teeth, not cranking back. And then always remember, you can reach around and you can use your other hand to kind of grab the trachea and the larynx and kind of manipulate it and move it around a little bit into view of where you need it to be. And once you get better at using those kind of hand-eye coordination and dexterity skills, you'll find that a lot of the airways are a lot smoother for you to visualize. Or maybe you need to switch to a Miller blade. Maybe you would have assessed that patient in pre-op, or maybe I would have assessed that patient in pre-op and said, this patient looks tricky. I don't think a Mac blade would be a good pick for them. I think I'm gonna probably just do a glide scope instead, and just start with a glide scope and not even worry about DLing someone who I already know is probably gonna be difficult, probably is gonna have problems desaturating very quickly, which is gonna make it harder for me to focus when I know they're immediately desaturating. So why mess around with that and go straight to a glide scope? Because then you're anxious, your hands are shaking, your endorphins are pumping, or catecholamines, I guess I should say, are pumping, and now it's harder for you to get your other things done that you need to get done because you're distracted. So why start yourself off on a rough patch like that? Start off smooth. Do the glide scope to begin with if you think that you potentially could struggle with them. And if then you tell me, well, I didn't think there would be a difficult intubation, maybe we could look at them together, assess the airway together, the chin, the environmental distance, things like that, and say, look at the teeth and say, what is it about this that made me probably anticipate this would be difficult and you didn't think about it? So those are all different things that you can do. Those are all different ways that can kind of help smooth you out when you're in your third year and you're trying to figure out why this is happening. If it's IV insertions, there's typically you have different IV sets. Some people get used to inserting IVs with a certain type of IV set, and you switch to a whole different type, and maybe you find that you're not as smooth with this new type of IV brand or the way that this IV is designed. It takes you a little bit of dexterity and skills to get back used to that one. That could be a potential. Maybe this patient just truly does have bad veins and is a difficult stick, and most everyone would have struggled on them. Maybe you're going in at too sharp of an angle. There's all kinds of ways that we can assess, like, what are you doing exactly that could maybe help you? Are you pinning the vein down, or are you kind of just free form stabbing at it and letting it squiggle out of the way and blow? These are all things that we could talk about. As a third year, you're going to have a lot of pressure on yourself. You're going to be thinking that you need to be perfect. You're not going to be perfect. And the way that you do that, take a step back, realize that that's the biggest thing that you can do. And then the next thing, ask for help. As a NAR, you're going to have a preceptor or somebody who's there to help teach you that day, and say, hey, this is what I'm dealing with, or this is what I was not that good at. What do you think? Ask for their help. Receive their feedback. Don't get defensive about it. Don't get upset. Don't get egotistical or decide, or beat yourself up about it and make it into them attacking you or something like that and feel defensive. Just take it in stride, take the feedback, and then try and implement it. And the next time you're intubating, try and remember to pull towards the corner of the room, towards the ceiling in the corner, and not up straight away like that. Think about it like that, and I think that's going to make a big difference in your practice. So that was my tips for third year NARS who are struggling with skills in intubation and IVs and all that kind of stuff, and maybe just clinical moments in their training, and worried about, are they going to be ready? What do they do? Are they going to be a terrible CRNA? Are they going to be not safe for anesthesia practice when they graduate? The answer is no. You're not going to graduate unless you're safe. If you pass boards and get all the way through your training, you will be a competent, capable anesthesia provider. But your whole life is going to be a journey of you perfecting things, learning new things, growing as a clinician. That's what makes anesthesia exciting and humbling. So you always just have to remember that you're never going to be the perfect person. You're never going to have it, know it all or have it all down. There's always going to be room for growth and improvement. And you can always rely on your colleagues. When you're out in practice, you'll call your colleague over and say, hey, I'm not doing so good at this art line. Can you bring the ultrasound and come give me a hand? I do that, frequently. So there's always times that I look to other people and say, hey, can you give me a hand, or what do you think about this case? Like, if you were to do this case, what kind of anesthetic would you like to, what would be your idea? So you bounce things off your colleagues, you talk to other people, you look at research, you look at the newest literature on certain types of things. It's just the whole journey of being a clinician and an anesthesia provider. It's lifelong, so don't stress. It's not gonna happen in 3 years 100% for you. You're going to always be learning. And that's my advice. Make sure to hit that like button, hit that subscribe button. If you're not a YouTube member, what are you doing? Join the memberships over here, guys. The memberships are awesome. You can join up. I give shout outs to you if you're in the Ketamine Kings level. We do CB critiques. I even do a 26-page study guide for those guys who are trying to get into CRNA school. If you want a mock interview, email me at boltcrna@gmail.com. I have a whole scheduling thing I do for you guys there where we can schedule a mock interview for you. And until next week, that's Bolt out.